Modern medicine is honestly insane in the best way. But if you rewind the clock, medicine was a straight up horror movie. Today, we're counting down 5 creepy, outdated medical treatments that were truly used on real humans. Were they really helpful or just misery with a medical license? All right, let's dive right in. Number 5, tobacco smoke enemas. I know this is going to sound like I'm blowing smoke with this first ancient creepy procedure, but medicine used to literally blow smoke and not into the lungs. In the 17 and 1800s, especially in parts of Europe, tobacco smoke enemas were promoted as a way to revive people, particularly drowning victims or people found unconscious. The logic was basically, smoke is stimulating, nicotine is activating, warmth might help, and if you can shock the body into responding, maybe you can bring someone back. So back in the day, medical staff and doctors used devices, literally bellows, to pump tobacco smoke into the rectum. What we understand today is that drowning isn't a need stimulation problem, it's a oxygen and circulation problem. Complications from this practice would have included severe irritation and chemical burns to the rectal lining, inflammation of the colon, tissue breakdown, infection, and in extreme cases, even perforation of the bowel, which is a life-threatening surgical emergency. On top of that, nicotine absorption could cause toxicity, arrhythmias, nausea, vomiting, and altered mental status. And I know what you're probably thinking. Do we still do tobacco smoke enemas today? Absolutely not. But the descendant of this era is that we now have evidence-based emergency medicine protocols, real airway control, real oxygen delivery, and real resuscitation science that actually saves lives. Number 4, cauterization with hot irons. If you've ever seen a historical scene in a movie where someone gets a wound sealed shut with a glowing red hot tool, that wasn't just a Hollywood depiction, that actually happened in real life. Hot iron cauterization was used for thousands of years, dating back to ancient Egypt and Greece, carried through Roman battlefield medicine, and heavily relied on during the medieval era. In fact, it was so accepted that early physicians believed fire was the final step when all else failed. For centuries, cauterization was one of the go-to medical treatments for bleeding wounds, infections, and even amputations. Doctors at the time believed that heat could purify wounds, destroy disease, and stop bleeding all at once. To be fair, sometimes it did stop the bleeding. Heat causes blood vessels to constrict and coagulate. So in a very crude way, it did work. Even Hippocrates, often called the father of medicine, famously wrote that when medicine and the knife failed, fire was the final cure. But the problem was everything else that came with it. A red hot iron doesn't just stop bleeding, it causes massive collateral damage. Healthy tissue gets destroyed along with the bad. Skin, muscle, and even nerves could be permanently damaged. You might stop the bleeding, but now you've created a larger wound, severe burns, intense pain, and a perfect environment for infection, gangrene, or sepsis. Now, here's the twist. It may sound downright barbaric, but modern medicine still uses cauterization today, but in a completely different way. In today's operating rooms, we use electric cautery and advanced thermal devices to precisely seal blood vessels during surgery. The energy is controlled and the target is specific. So yes, the idea of cauterization survived, but luckily not the medieval execution style version. Number 3, heroic purging. For thousands of years, one of the most common medical treatments wasn't surgery or medicine, it was purging. By purging, I mean intentionally making people vomit, have diarrhea, sweat excessively, or if you really want to party, all 3 at once. The belief was simple and terrifying. If you were sick, something bad was inside you and it needed to come out by any means necessary. And this practice of purging goes all the way back to ancient Greece and Rome and was heavily rooted in the theory of the 4 humors: blood, phlegm, black bile, and yellow bile. In other words, physicians believed illness was caused by an imbalance of these fluids. So the solution? Remove the fluids! Doctors used emetics to induce vomiting, strong laxatives to cause explosive diarrhea, and even bloodletting. Sometimes all all on the same patient. This was called heroic medicine because the treatments were extreme and survival was considered optional. The problem, or shall I say one of the problems with this antiquated thought process, is that purging doesn't fix infections, organ failure, or chronic disease. What it does, however, quite well is cause dehydration, electrolyte imbalance, and cardiovascular collapse. Patients would become severely weak, dizzy, confused, and hypotensive. Vomiting and diarrhea can lead to dangerous drops in potassium and sodium, triggering arrhythmias, seizures, or sudden death. Nowadays, we understand things a bit differently. Vomiting and diarrhea are symptoms, not cures. In other words, they're the body's response to irritation, infection, or toxins, not something you should force unless there's a specific reason. Number 2, body snatching. This next one isn't exactly a procedure, but it absolutely shaped every surgery you've ever heard of. Before surgeons could safely operate on the living, they had to learn the human body in detail. And in the 1700s and early 1800s, there was one major problem. There weren't enough bodies to study. Medical schools were expanding, surgical techniques were evolving. So what happened? Enter the resurrectionists, aka professional grave robbers. The medical schools quietly hired people to dig up freshly buried bodies and deliver them to anatomy labs under the cover of darkness. These weren't old skeletons. These were newly buried individuals, sometimes exhumed within days of burial. From a modern perspective, this sounds horrific, and ethically, it was deeply problematic. But here's the uncomfortable truth. Anatomical dissection changed medicine forever. Before structured cadaver study, surgeons operated based largely on guesswork and surface landmarks. They didn't fully understand vascular pathways, nerve distributions, or surgical planes. Dissection allowed physicians to map arteries and veins, understand how organs relate to one another, and develop safer techniques. Without this knowledge, modern procedures like appendectomies, C-sections would not exist in their current form. Today, cadaver education still plays a foundational role in medical training, but the big difference now is obviously consent. Modern body donation programs require explicit documentation, legal oversight, ethical handling, and respectful cremation afterward. Medical students still learn anatomy in cadaver labs. Surgeons still train on donated bodies to refine complex procedures, but everything is regulated, transparent, and voluntary. Number 1, early C-sections. Today, C-section surgeries for delivering a baby are incredibly common and often life-saving. They're performed in sterile operating rooms with anesthesia, antibiotics, blood products on standby, but historically, it was something very different and detrimental. For most of ancient history and well into the 1800s, cesarean sections were almost exclusively performed after the mother had already died. Performing abdominal surgery before modern anesthesia, before antibiotics, and before understanding sterile technique was almost universally fatal for the mother. You see, the uterus is one of the most vascular organs in the body, especially during pregnancy. Cutting into it without surgical control means massive bleeding risk, and back then, surgeons had no reliable way to control hemorrhage. Infection was another major issue. This was pre-germ theory, meaning instruments were reused, hands weren't sterilized, and the abdominal cavity was exposed to bacteria without anyone even understanding what bacteria were. So if the mother was lucky enough not to die from blood loss during the procedure, she was at extreme risk for sepsis afterward. It wasn't until the late 1800s that survival began to improve. Prominent surgeons of the time refined uterine suturing techniques, allowing the uterus to be properly closed after incision. The introduction of antiseptic technique dramatically reduced infection, and eventually anesthesia allowed surgeons to operate with precision instead of speed alone. Today, C-sections are one of the most common major surgeries performed worldwide. We have uterotonics to help the uterus contract, we transfuse blood if needed, we manage pain. And maternal mortality from planned C-sections in developed countries is extremely low. That's been a quick breakdown of some creepy and unpleasant medical procedures from our past that we still kinda use today. If you guys found this video interesting, make sure you binge watch this entire playlist right here. It goes into more of the darker sides of medicine, and don't forget to tell your friends to subscribe. Thank you so much for watching, and stay healthy, my friends.